on entry and you want to introduce yourself. So I would say, hi, I'm Nurse Roselin. I'll be taking care of you today. And you want two identifications. You want a verbal, and then you want the date of birth, and then you would check the wristband. So you would ask, can I get your name and date of birth?
Yes, I'm Ms. Duan. My date of birth is January 1st, 2000.
And then you would confirm by looking at the wristband. And then you want to always announce what you're doing. So you'll tell them, I'm here to take your vital signs. And then when you're taking pulse, you always want to make sure that the patient is in a comfortable position with their arm aligned with their heart and the palm facing up, which she's in that position. And then you want to palpate around the wrist area. And once you would find it, if it's a normal pulse and it doesn't feel irregular, you could count for 30 seconds and multiply it by 2. But you always want it to be equivalent to a minute. And if it feels irregular or any abnormality, you want to count for the full minute. And then that's how you would do pulse. And our normal pulse would be anywhere between 60 to 100. Anything above 100 would be tachy, and anything below would be brady. Now we'll be measuring respirations, and a good way to transition from taking pulse to doing respirations is once you complete the 30 seconds or the full minute, you could observe them, and you want to observe for the full minute, or you could do the 30 seconds if they seem to be breathing normally, and you want to watch the rise and fall of their chest, or you could transition their hand and place it on their chest and place your hand on top of theirs. You never want to place your hand first because that would be kind of violating their privacy and you don't know what they're comfortable with. So you would place your hand on top and you would feel the rise and fall of their chest. Or if it's hard to observe the rise and fall, this will be the best way to count the respirations. And one breath would be one full rise and fall. So it would be one inhalation and one exhalation, and that would be one full breath, and you would count it like that. So that would be that way, or you would just observe like that. And if there's any abnormal breathing, you always want to redo it to confirm that they have an abnormal breathing. When measuring blood pressure, you always want to start by making sure your patient is in a comfortable position. So if you're taking blood pressure on this side and they're comfortable with keeping their arm on the machine, as long as their arm is straight, palm up, and aligned with their heart, this is fine. And if they prefer to have their arm resting, they could place their arm on the table with their palm facing up, as long as it's more so straight and aligned with their heart. But I'll be taking it on this hand, and you would ask, are you comfortable in this position? Yes. So then you would proceed and you would palpate over here for the radial pulse, and you're gonna find it. And then you would want to estimate based on their baseline of where their pulse was, where their systolic is going to be, and where you would pump 30 above their baseline. Comfortable position, you want to make sure you're using the right cuff. So you want to make sure that it's not too big, because if it's too big, the blood pressure is going to be really low, and if it's too small, the blood pressure is going to be really high. And when you're placing your blood pressure cuff, you want to make sure that first you're palpating for the brachial artery so that you know where to align it. And the cuff is always going to have this mark that says artery marker, and the Velcro is going to be facing up, which is a little tip that I like to use to help place it properly. And you would be placing it an inch above the antecubital space, which would be like equivalent to like a finger or two above the bend of the arm. So where I palpated the brachial artery is where I'm gonna align that first mark. And then you wanna wrap it where it's snug enough, but not tight. Usually to where you could slip your finger in, so you know it's not too tight. And then you wanna palpate. You can either palpate the radial artery or the brachial. I like to use the radial only because it's a little more comfortable. And then you would be holding your bulb and tightening the knob clockwise. And you would be palpating. And you want to make sure that you feel the pulse. And then you would be pumping it until you no longer feel it while looking at the values. So you could estimate the systolic. So I stopped feeling it around 160. So that's where I could estimate her systolic to be. And that's important for later on because you would be pumping it 30 milliliters above the estimated systolic. So I'm gonna place this, put it down for a moment. But the next step, now that you have everything comfortable, would be to put on your stethoscope. And you wanna make sure that the stethoscope is comfortable because it's important for you to hear the first beat, which is usually gonna be faint. So you wanna make sure that it's on properly. So usually it has to curve in so that it's going into your ear canal. So I would put it here, and like I said, you wanna palpate the brachial so you know where to put it. So I knew that hers was here. So I would place that there, and then you would place your fingers on the bell of the stethoscope. Thank you. And you wanna hold it firm, but not applying too much pressure. And then we'd be tightening the knob again. And now that we know what our estimated systolic is, we're gonna pump 30 more. So since it was around 160, we're gonna pump it to 190. So I'm just gonna start pumping. And now that I'm at 190, you're gonna slowly release the knob. So you wanna tilt it really slowly and smoothly where you could watch. And this, you're gonna be listening for a faint sound. So I heard it around 165, and now I'm listening for the diastolic, which is gonna be the last sound. And then the last sound I heard was around 82, so that would be the diastolic. And then once you're done, you would take off the cuff to relieve the pressure that they just felt. You would thank your patient, and you would wash your hands upon exiting the room, and you would always clean the blood pressure machine. So you would wipe down the blood pressure cuff and everything that was touching the patient. So once you're done taking the blood pressure and you took off the cuff, you could ask your patient, how do you feel? And then whatever they report, that's how you're gonna analyze how they tolerated the procedure. And then you always wanna wash your hands as you're leaving the room. And then you wanna document your findings, which would be how they stated that they felt, so you could record how they tolerated.